Hello everyone, Maria Trusa, CEO of Form A Medical Center,
And
with
Gina
my partner in crime, Gina Capelli. So our show, Reflect and Reset with Maria and Gina, it's a show that we try to give information to our community that is valuable. And Gina and I actually decided to do a show without a guest because of our Forbes article that came out. We are getting a lot of questions, and we decided to talk about the broken healthcare system. And boy, our system is broken, and we have been trying to find solutions for this system. But let's talk about, Gina, the major issues that we find having a medical center and dealing with our patients in the billing department. We were having a meeting the other day, and one of the biggest challenge that we were talking about is with the deductibles.
Yeah, so I think the problem is that when somebody signs up for an insurance, you really need to understand what you have. Just because you have insurance doesn't mean you're 100% covered. So there's something called deductibles, and deductibles can range from $0 to $6,000, right? So I mean, I think some of the Medicaid plans, you may not have deductibles or co-pays. But most of the times now, especially in this day and age, deductibles are pretty high. So when they get insurance and they're paying money for the insurance, or even they're in the the healthcare system through the Obamacare, they're going to find, well, why did I get a bill?
Right.
Because you have a deductible. And what we want to do is we want to educate you on how to understand what your policy is and the right questions to ask your representative.
Agreed. Let's start by talking about our insurance, right?
Yes.
So Gina and I have insurance, and our business pays for the insurance, but it is costly. It's $800. Over $800 a month. Each of us pay. But it doesn't stop there. We have a deductible of $2,500. So whenever we go to the doctor, until we reach that $2,500 deductible, we have to pay out of pocket.
Except for preventative care. If you're coming in for your annuals, then your deductible doesn't apply.
Right.
But if you're coming in because you're sick, you're going to get a bill. And just so you understand that. Now, the other thing that you should keep in mind is that the insurance companies the providers can only bill you as much as the contract is between them and the insurance company. So they can't be billing you $500 for a visit if that's not what the contract is between them. So you can always ask your insurance company.
Yes, and the other issue is the co-payments. So some patients feel that, maybe you can write off my co-payment, but what they don't know is that this is actually illegal.
Yeah, it's illegal.
You cannot write off the co-payment. And what happens is, let's say that you have a visit where the insurance company says you are allowed to get $100, but the patient's responsibility for the copay, let's say, is $40, let's say. So they deduct out of the $100, they only pay us $60 for that visit because we are responsible for collecting it from the patient, right?
And a lot of the times, what happens is you have a copay, of course, but you also have a deductible. So when people pay their copay, they think, well, I already paid my copay. But meanwhile, your copay went to your portion, your portion, but you have a deductible that the insurance company isn't going to pay until that's satisfied.
So listen to how expensive the system is. And for us, we've been looking, how do we resolve this? The issues in healthcare, we have unaffordable, right? Transparency. Let's talk about transparency. When we go to the doctor, or we have we go to an imaging center, or we go to the hospital, we go to the emergency room, do we know how much it's going to cost us? It's the only industry that you go and you never know how much you're going to pay, and you get the bill after the service is done, right? And
sometimes they even do services without letting you know. And so you might be in the hospital, for example, in the emergency room, and they're going to run a CAT scan, or now these are expensive. So these are going up, 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 up. Your bill is going up. And some of you, and I know for me, example, I can't afford some of this stuff when it comes out. Because it could be thousands and thousands and thousands of dollars. But you're right, there's no transparency in the healthcare system.
But what we want to show you is that, let's say you go to the hospital and you get a bill from the emergency room. You can call and you can go into a payment plan, or you can go, and I actually just did that not too long ago remember when I had that accident something fell in my head, and I ended up with close to a $4,000 bill. And I said, I'm not gonna pay that, all up front. And I called and I said, I'm gonna go on a payment plan. And to be honest, I can afford it, but I know that I'm being overcharged for that $4,000.
So why don't you explain why you're being overcharged?
Yeah.
Let's get to that.
So let's talk about how we are overcharged when we go to any medical facility, either physicians or you go to a hospital.
Especially as the uninsured.
Yes.
So let's put that, because the providers have contracts with the insurance companies, so they write off the difference of the bill, okay, if it's not deductible. But if you're uninsured, this is where you get in trouble.
Yeah. So if you are uninsured, and then we're going to talk about the insured, because there is some tricks there too that we don't understand. But the uninsured, you are being charged. So Medicare, let's talk about Medicare being the base. Medicare, everybody accepts Medicare. I don't know many providers that.
No, everybody.
I mean, pretty much everybody. And for those of you that might be a little confused, Medicare is for people over the age of 65, I think it is,
yes, that's right.
or people that are disabled and not able to work. Some people get on Medicare. So Medicare determines the rate that the patient will pay. And I'll give you an example. If a visit, I'll go to the $100 to keep it simple. If a patient comes to have it, go to a doctor, and Medicare says the only thing you can charge that patient is $100. Let's say Medicare pays 80%, because normally they pay 80% of the allow amount. And then the insurance, they have another insurance that could be AARP
or nothing.
Or nothing. They have to pay for it. But that doctor cannot charge you, the patient, more than $100. So when you don't have insurance, the charges for you is over 300 to 400% of Medicare for a regular primary care visit. And it could be more for a specialist. It could be up to 600, I think it is.
And hospitalization.
And the hospitals, how much?
Hospitals, I think we've sold like 700 to 800%.
700 to 800% of Medicare.
So that $100, if you're in the hospital, now turned to $800 for the same visit.
And that's why the bills become thousands of dollars. Right. Same thing when you go to a lab. If blood is being drawn, you are paying them. I mean, like probably.
No, I think that's over. I think it's
probably
like
close to 1,000% of Medicare. Medicare could pay $5, $10 for a test, but the charge to the uninsured population is
it could be $100. It could be a couple $100.
It's so scary. People say, how could this be? The irony is that we talk about this, but how many people actually are talking about this situation? Because it makes no sense to us.
Right.
How is it? And I've been in healthcare, over 32 years of my life. You've been in healthcare.
Over 20 years.
And the system hasn't changed. The other thing, Gina, is that the insurance negotiate differently with different doctors.
Yes.
So what you have to know is Gina and I are a small medical center. We are considered for them. They don't
We're nothing. We're peons. We get
peanuts.
pushed around. We get pushed around.
They don't really need us.
Yes.
So when we are trying to do a contract with them, they're like trying to give us below Medicare rates.
Way below. No, you're not even talking about 90%. You're talking 60%.
Yes.
And it's really unaffordable for us to even keep our doors open with rates like that.
Right. And let me tell you, like some insurance companies, we are reasonable people. We feel if they give us 100% of Medicare, we already take Medicare. Right. We want, if we can get a little bit more because of the work that we're doing to help our community, yes, of course. But there are practices out there because they have so many doctors. They are mega groups or they're attached to a hospital that they're getting 200% of Medicare. They're getting 300% of Medicare or 150% of Medicare. And what happens with that? Who actually is paying for that, Gina? Who pays?
You are. We are.
You are.
We are. We all are.
That's why the system is
broken.
so broken. So it makes that also makes no sense. So how could you pay a quality practice below? You want to try to pay below Medicare, and yet just because it's a mega group that sort of created in a way a monopoly.
And it's so unfair that what would like to fight for is that everybody gets the same. And whether you're small or big, because it's almost like they're discriminating.
Yeah.
They're discriminating against us because we're only, let's say 7 doctors versus, 30 or 40 doctors. And, if everyone would just collect Medicare and accept maybe a little higher for the hospitals because they have higher costs.
Right.
But for everybody else, we should collect Medicare.
Yes.
And the system would be a little more balanced.
Absolutely.
Your insurance rates won't go through the roof, and you'll start seeing that, let's say if you're paying a certain rate, maybe a little bit lower than you're paying now, it'll stay the same and it won't keep increasing. You notice every year you're getting a 30% increase, 34% last year. It's scary. And
Right.
it's unaffordable. And what's finding is that people can't afford to get health insurance anymore.
But it is a cycle that is a vicious cycle that gets worse and worse because what happens is the people that are uninsured, they don't go to the doctor. And I know this happens a lot with our Latino population. We let's talk about that patient that a mammogram, listen to this story, a mammogram with our medical membership, which we'll talk about, a mammogram, a patient pays $100.
Yep.
And we had a patient, what happened to that patient?
So that patient, by mistake, went to the local hospital and had her mammogram done there, and she got a $1,300 bill.
$1,300
because she went to the wrong place.
Yeah.
Now the difference between costs, as you can tell, is if this place can do it for $100, there's no reason why the hospital couldn't have done it for less, or maybe even a little over the $100. But not $1,300.
Not $1,300.
They're charging you for the read. They're charging you for the diagnostic. They're charging
For
you
everything.
for everything.
So what happens to a patient like that?
Yeah.
That patient will pay the bill because a lot of them you go to collection and nobody wants to really go to collection
And never go back.
And they never go
They'll
back.
never go back.
So what happens with a patient like that? They never have a mammogram again. And the shame of it is that they will go when it might be too late.
Yeah.
Or when they actually get cancer and they have to go through all this treatment that could have been prevented. And this is one example. Yeah. So we talked about the unaffordable healthcare costs. We talked about transparency. We're going to talk about accessibility.
Yes.
The other thing that happens with our patients is that the patients in the community is that they're going to doctors. They have to take time off from work.
Right.
Because the doctors are normally not open until later. And one thing that we realize here is that we need to be open every day. So we're open 365 days. We're open until 8, but our mission is really, once we get to the place that we want to get, because we're not there yet as far as the volume is concerned, we want to be open until midnight if we could.
And that's really, we have to be able to make it accessible because people don't want to take off of work.
Yeah.
They can't afford to take off of work. Because unlike salaried employees, if you're an hourly employee, you're not getting paid if you're going sitting at the doctor's office. And that's really hard for a family, especially somebody who's trying to, put food on the table for their family.
Yeah.
So we have definitely starting to change the way we look at things to be able to help, our patients.
Yeah. And the other thing is about the fact that we need to educate the community as a whole, how important preventive medicine is. So for that's why you have this show, right? We have Reflect and Reset. We talk about preventive medicine. We bring you specialists to talk to you about things that you don't know. Because what we are finding is that, especially, I go back to the Latino community, a lot of this community, they don't know. And we are going to continue to educate our community. So,
the other thing is that, and a lot of things that a lot of people don't understand about us is we go above and beyond. And that's what I love about us. Because, you know, if there's an issue, you know, the president or CEO gets on the telephone with you. But we guide you, you know, and whether you're insured or uninsured, we're here to guide you. So everything that we bring on our shows, we say, call us. If you want more information, call us. Let us help you get the information that you need to make educated decisions and make sure that you start taking, you know, care of your own health care. You know, you're responsible for your health care. Nobody else. You can't put a pointing finger to anybody else. You are responsible for your health care.
You need to take action to really. So when it comes to, like you said, we go all out.
Above and beyond.
I mean, I've called I have called hospitals to negotiate for patients. I've called many places to make sure that we are getting the best deal possible for our patients. So let's get into the meat of how do we make affordable healthcare? How do we create an affordable healthcare system? And Gina and I, like we said, we're very proud that we were written on Forbes magazine.
Yes.
It was an incredible article. For those of you who have not read it, you can go into our website and actually be able to get access to it, because it explains what we have done so far very clearly.
And what we're doing and what we want to continue to do and grow.
So,
you know,
so Gina and I came together in 2015, and
the best day of her life.
Of our lives.
Of her life. When she joined me, oh my God, it's like she just saw stars. She's so happy.
She's absolutely right. You know, all joking aside, I'm blessed.
Yeah.
You know, and I know we both feel that it is, you know, divine intervention that put us together, and we are creating, and we're actually changing the healthcare system in this little office. And the idea is to continue to grow this. Because we decided to really focus on solutions, because we all knew what the issues are. So if we focus our energy on solutions, what impact can we have? Well, let's talk about the impact that we've had. Yes. Let's talk about the medical membership.
Okay. So, you know, Maria and I decided to figure out a way, because we were having a lot of people coming in, self-pay people, now, you know, kids that are coming off their parents' insurance at the age of 26. Millennials, right? So that maybe come out of school, don't have a job, or have a very low-paying job. They can't afford these rates for health insurance, so they think they're invincible and they opt out, right? So what we said is, how do we fix that? So we came together and we figured out a program that would be able to help our patients, the community, get the health care that they need without breaking the wallet. So we have 3 medical plans. We have the basic plan. For $29.95, you have unlimited urgent care visits.
What do I say, Gina?
If you don't have an insurance, you need to be a member at Format.
You're crazy.
You're crazy
Not to be a member of Format.
You know,
for $29.95,
right.
I mean, we talk about don't buy bottles of water.
Right. 2 bottles of water for a week. So it's so affordable that, and somebody will say, well, you know, I don't want it because I don't really go to the doctor. But you know what? You should be going to the doctor. And that's what Maria was trying to say. Because you should have a baseline. You should be able to go to the doctor and not worry about the bill. So that's for $29.95 a month. For $59.95 a month, you get the Plus plan. The Plus plan is unlimited urgent care and unlimited primary care visits. That's with a primary care internal medicine doctor, as well as 10 visits to our physical therapy. For $59.95, one physical therapy session is more than the whole month. So you can start to understand that this is something that's truly, truly out there for you. Last plan, $89.95 a month. Unlimited urgent care, unlimited primary care, 20 visits to physical therapy and gynecology visits. So yes, this is more geared to women, but for people with back issues or chronic pain issues, this is a great plan for you as well.
Yeah. And the program is, so we want you to understand that the statistics of this country is that there are over 27 million people uninsured. And this includes immigrants, this includes people that are making above the Medicaid threshold. Because what happens is if you are poor, let's say you make under is 20 something.
Yeah, sorry.
22, 20 something is you're making less than that, then you apply for Medicaid and you can get Medicaid and you get excellent coverage because most people are taking Medicaid, not most people, but all the hospitals pretty much do. But if you make a little bit above that, you no longer qualify. But then you don't qualify for affordable care or what it's been called Obamacare because it could be 300, 400, 500. And the other thing is that even if you're working and they offer you a plan, like we offer here, but the employees still have to pay close to $350, $400.
More than that because the rates just went up.
The rates just went up.
So they're paying about $400 and something dollars.
People opt out and they decide not to be insured. So 27 million people, and let's talk locally.
Yeah.
Right, Gina? How many people locally?
Well, it was 183,000, but that was back in 2010 census, and it didn't even take into consideration the undocumented. So the new census is coming out, as you guys all know. You probably got your census, you filled it out.
It was 2020.
Is it 20? Well, I know we filled it out, but I think, because I know we got the census here at Fort May.
I haven't done it yet.
Anyway, well, maybe the businesses got the census first, but anyway, so 2020, your next one's going to come out, and I'm sure it's going to be booming now because the penalty is no longer there. So people do not have a penalty for not having insurance.
So what we want you to understand, this is the comprehensive plan. This is a membership that we have thought in so many ways of helping the community get access, not just to Fort May. And by the way, at Fort May Medical Center, we have urgent care, primary care, we have physical therapy, we have GYN, podiatry, and neurology.
Right.
And our goal is to continue to grow, access to care within the facility here. But for now, we have negotiated with many specialists throughout Westchester, but we have, any specialist that you need, basically, we already tell you exactly how much it's going to cost you when you're going to that specialist or you're going to the imaging center. We tell you exactly how much you're going to pay, which takes care of the transparency. But the other thing with this program, you're going to know how much you're going to pay everywhere, but you have to pay at the time of service, because otherwise, if we start billing you and trying to collect the money, or the partnerships that we created, they wouldn't do it if they have to bill the self-pay population. But we also have Quest.
Yeah, we have Quest Diagnostics that are giving us
80%
discounts,
Quest.
and then the local pharmacy, Sunshine Pharmacy, great pharmacy, giving us 70% discounts. But the other thing that we were saying about going above and beyond is that if we don't have it, we find it for you.
Yeah.
And so if we don't have a specialist that you need, we will go and we will find you a specialist and we will negotiate the rate for you to go see that specialist. We do not leave you alone.
Yeah.
Because I know I had some health issues, asthma and some diverticulitis. I had some issues. It's hard to navigate the system.
Yeah.
And I'm educated in the healthcare field. I can imagine what happens with people that are totally floundering when they don't know where to turn.
Yeah.
So we are the advocates for you.
We are. And that, I'm glad that you said that, because we have a patient navigator.
Yes.
So what Gina was saying is, how do you navigate the system? So we have somebody that is dedicated to you, to making sure that when you come here, that you know exactly if you need to have a colonoscopy, that she'll guide you, even booking the appointment if you need to, but she'll tell you exactly how much it's going to cost you to have that. But in addition to that, Gina, we are we are affiliating with the Hudson
Valley Cancer Service Program.
Yep.
Right.
And what is happening is the Hudson Valley Cancer Program, last year we sent them 150 patients that actually had cancer screening for free. And we found five people that we helped prevent cancer.
That actually had the cancer, but we got it at a very low stage.
Yeah.
So.
And they didn't have insurance. So the idea is then once that happens, then we figure out a way to get you access to the treatments that you need. and we affiliate with different nonprofit organizations that are working together to make make the healthcare system in a way a holistic system. Where, look, I was just talking to West Fair Rides the other day. Free
rides to your medical care.
To your medical care.
To your doctor or appointments. I mean, it's a no-brainer. There's no reason for you not to see a doctor. And what about Montefiore? We are now talking with Montefiore New Rochelle to work with getting more specialists, getting surgeries, getting colonoscopies. We also started this campaign, and I want to give you a lot of information so you know to look at our website. We started this campaign called Did You Know? And these are short little tidbits to be able to say, did you know that by the age of 50, you're supposed to have a colonoscopy? And then if cancer runs in your family, it should be even sooner. Yeah. So did you even know that? You know, when should you have a mammogram, ladies? Do you know when you should have your first mammogram or visit your first gynecologist? It's just, there's so many things that I didn't know that. You know, I didn't know that.
Yeah. And Gina, let's talk about something else that is very powerful that we do here is that we have the representative from Affordable Care or Obamacare. Yeah. So if you don't know if you can qualify to get insurance, you actually can call here and we will connect you with representative from the different companies like MVP, Fidelis. Actually, they're not here yet, but there's that roster. It's going to keep growing.
Yes, it is. And now actually we're going to be working with a couple other insurance companies. I'm not going to say who they are yet, but as she said, we are going to have more options for you. But you know what I love about them also is that if a plan doesn't work within their plan, they will look at other plans for you. It's not like, okay, now I got to go meet with the Fidelis guy, or now I have to meet with the MVP guy. They're here for you. And we have a questionnaire when you first come in and you're uninsured, is do you have insurance? Do you know if you qualify for insurance? And this is what we're trying to do to be able to capture that data to help you. So we are here for you.
Yeah.
I mean,
well, we need to talk about the next thing that we thought about. And
I know what you're going to talk about.
Yes. So, what was interesting as we sitting here and we're speaking about everything that has been done since Gina and I got together, it's mind blowing. Yeah. We don't really stop to really think about it, and sometimes we were actually talking about that we need to pat ourselves in the back once in a while because you're just focused on resolving and next and next and next that you don't stop to appreciate the impact that we already made. We have made a tremendous impact, but we know we need to do more. And that's how, let's talk about that, how Promise to Aid, which is our nonprofit that is going to come.
It's coming.
It's coming.
We're waiting for our
this
approval
year
for the tax exempt approval. Yeah. But it's coming. But with that in mind, the reason why we even thought of that is because of one of our members that came in to see us and actually took the intake sheet and was looking at it like this. And our reception said, "Can I help you?" And he said, "I can't see." So what did we do?
So this person was a dishwasher at a local restaurant, and we sent him to the ophthalmologist that is working with us, Bruce Gordon, who is he was the first doctor that decided I want to be your partner. Yeah. So we send him there. He calls us and says we have a problem because this man needs 2 cataract surgery, 1 on each eye, and he is becoming legally blind. So we started negotiating with him, and he said, "I'm going to do everything I can for you." So we ended up getting the cost of the surgery. It could have cost $8,000 down to $1,600. Okay. Now I know that he put together an effort, and everybody really gave us the best deal they could. When we went to speak with the patient said, "I only have $1,000. I am not going to be able to come up with more money. I'm sending my family money to he's working for them so they can eat." And that's, I went and donated $300 myself. And then I asked my brothers to donate $300, but I said, we're not going to be able to do this for every patient. So we ended up creating Promise to Aid that is going to be paying for surgeries, for medications that are too costly, but the patients are not getting the right treatment because the medication is too costly. So we Promise to Aid will pay for that lady there's a lady that needs hip replacement and she can't get it done.
Right.
And even though we've negotiated great deals, it's too much money.
And if you're uninsured and you don't qualify for Medicaid, right? Even if you're undocumented, and you get, God forbid, you come down, you have cancer. This gets covered by Medicaid. Life-threatening diseases.
Disease.
But if you're living with pain, that is not life-threatening. You're going to have to suffer.
Yeah.
So,
and unfortunately, we had to take action because we cannot see our patients and not find a solution. And this is what at the beginning was really hurting us. But we are definitely, Promise to Aid is going to happen within a few months. And one of the goals of Promise to Aid is that people are going to talk about this nonprofit organization that everybody wants to go to their parties because we know how to party.
Well, she learned it all from me. But it was honestly, we're ending, but it was such a good show.
Yeah.
And I just want to say, call us. If you have any questions about what you heard here today, call us. You have the number 914-723-4900. You can ask for the billing department to help you with anything with the deductibles, to understand your insurance. You can ask for the patient navigator to talk about the specialist. You can ask for one of us.
Yeah.
Call us.
Call us.
If you speak Spanish, ask for Maria, because I speak Spanish. But most of you that are listening right now speak English because you're listening to an English program. So you are welcome to call me as well.
Yes. So one thing we want to say before we leave also is that we care what you think of us. We want you to help us continue to be better. So whenever you come to see us, you're going to get a survey, and we want to hear from you, what can we do better? Because we know that we can improve, and that is our goal. We have gone through a journey this past 3 years that has been interesting ups and downs, but we are going up. And you can help us get to a place where we are getting you what you need, the best healthcare system for you.
Yes.
Anyway, partner, I think we covered so
Everything.
much. I hope you guys enjoyed it. If you like our show, please make sure you like us, okay, on social media. Bye-bye. Take care.
Bye.